The Seneca Scourge is a gripping medical thriller that thrusts readers into the chaos of a deadly influenza pandemic. Carrie Rubin combines medical realism with psychological suspense, creating a novel that feels both chillingly plausible and emotionally intense. The story follows Dr. Sidney McKnight, a young physician working in a small hospital when the world is suddenly struck by the most lethal influenza outbreak in history. As patients flood the wards and resources dwindle, Sidney struggles to maintain her composure while fighting to save lives. Her determination is fueled by both professional duty and personal conviction, but the overwhelming scale of the crisis pushes her to the brink. Into this chaos steps Dr. Casper Jones, a virologist whose sudden arrival coincides with the emergence of the virus. Casper is brilliant, eccentric, and unsettlingly secretive. His knowledge of the pathogen seems almost too precise, raising suspicions about his true motives. Sidney is torn between trusting him as a potential savior and fearing him as a possible threat. The novel explores the ethical dilemmas of pandemic medicine. How far should doctors go when resources are scarce, and what sacrifices are acceptable in the name of survival? Sidney must balance her compassion with the harsh realities of triage, while also navigating her growing mistrust of Casper. As the virus spreads uncontrollably, Sidney and Casper race against time to uncover its origins and develop a solution. Their uneasy partnership is fraught with tension, blending professional necessity with personal conflict. The suspense builds as Sidney uncovers disturbing truths about Casper's past, forcing her to confront whether he is humanity's best hope or its greatest danger. Themes and conflicts: medical realism, detailed depictions of hospital chaos, virology, and patient care. Trust versus suspicion. Sidney's relationship with Casper highlights the difficulty of collaboration under pressure. Ethics in crisis. The novel questions how far doctors should go to save lives when resources are limited. Human resilience. Despite fear and loss, characters fight for survival and truth. Character dynamics. Dr. Sidney McKnight. Intelligent, compassionate, and determined. Her arc explores resilience in the face of overwhelming odds. Dr. Casper Jones. Brilliant yet enigmatic. His motives remain unclear until the climax. Supporting cast. Patients, colleagues, and community members add emotional depth, grounding the thriller in human experience. Style and tone. Rubin's prose is fast-paced, accessible, and suspenseful, blending medical detail with thriller pacing. The tone is tense but not overly grim, making it engaging for readers who enjoy both science-based fiction and character-driven drama. Climax and resolution. The climax erupts when Sidney uncovers the truth about Casper's connection to the virus. Betrayals are revealed, alliances tested, and Sidney must risk her life to stop the scourge. The resolution is bittersweet. The pandemic is contained, but Sidney realizes that trust and truth are fragile in times of crisis. Her victory is tempered by the scars of trauma, leaving readers with both closure and lingering questions.